Well, approximately 1.5 million Americans have lupus, and 16,000 new cases are diagnosed each year. Even worse, doctors don't know what causes lupus. So here to talk about this mysterious disease is Dr. Mohammad Khan. Dr. Khan, we appreciate you coming in today.
Well, thank you for having me, Hope.
Okay, let's just start basic and tell people what lupus is.
So lupus is actually an autoimmune condition in which your own body recognizes your certain proteins as foreign and starts attacking your own organs, different organ systems.
Okay.
So the condition, it has different flavors to it, and it comes from anywhere from mild disease to very severe disease, depending upon how and what organs are involved.
Okay, so we mentioned that doctors don't know what causes lupus. That hasn't been determined?
That is correct. We are working very hard to find out the real cause for it, but at this point, it's still a little obscure exactly what causes it. There are certain host factors that come into play that cause somebody to have lupus versus somebody who doesn't have lupus, but the exact cause, etiology, is not known. Okay,
so there are a few external stresses that could trigger lupus. What are those?
Commonly infection, viral illnesses, bacterial infections, exhaustion, certain stress, any kind of a stressor that can trigger a flare.
Okay. And what are the symptoms that people would be dealing with if they did have lupus?
Well, there's a few common symptoms that people have who have lupus. For instance, there's chronic fatigue, tiredness, extreme tiredness, poor energy levels, a rash. When you go out in the sun, you have what we call photosensitivity. And then there is oral sores or nasal sores, Raynaud's, which is purple discoloration of your fingertips.
Wow.
And joint pains, arthritis, swelling of your joints, unexplained cause. These are all depending upon what organ is involved. So it's a very organ diverse disease.
All very unpleasant symptoms.
It is.
Symptoms that if you had, you would know that something is wrong.
Definitely. And if people have, I would encourage to seek your doctor's attention as soon as if you feel, somebody feels that they have these symptoms that fit this kind of a profile.
Okay, so if somebody comes in and they have these symptoms and you think they have lupus, how is lupus treated? What would you do?
Well, like I said, again, the therapy is directed towards the degree, the severity of the disease. So mild diseases where people have joint pains, there's nothing much we can do in terms of intervention except start them on some basic medications like Plaquenil and maybe steroids, a little bit of steroids. But again, if it's severe, then we have to work on immunosuppressive agents because the goal is to suppress your immune system, which is hyperexpressive because of autoimmunity.
And can lupus be fatal?
Yes, it can be fatal, but it's not contagious. It's fatal depending upon the severity of the disease, yes. Like I said, this disease has a predilection to go towards the kidneys. So it can cause significant, kidney damage and kidney failure. And also sometimes affects the brain and the central nervous system, which it can be fatal.
Well, good information. If you have any of these symptoms, make sure you call your doctor. Dr. Khan, we appreciate you coming in.
Thank you so much for having me.
Thank you so much. We have linked some additional information about lupus to our website. Click on news9.com, scroll over to the CNN News 9 tab, and click on First at 4.